Uh, Friday mornings is usually one of the lighter days, so I can round and get out and do some things that I don't traditionally get to do. Our meeting, so we have less meetings typically on Fridays than we
Mhm.
do Monday through Thursday.
Wonderful. Do you do like what time do you get to the office? Like this morning, what time did you get to the office
Uh,
or to the
about
hospital?
7 o'clock.
Oh my gosh, you and Mary Cheatham, early birds.
Got to catch the
Tell me
wrong
you
Best part
don't.
of the day, Harvey. Best part of the day.
That's right.
Goodness.
Look,
Well,
my wife is up before I am, so I can't complain.
Smart man.
goodness. Truly, truly. Well, we're really excited today to have Mr. Harvey Case on. Mary Cheatham's going to tell you a little bit more about him, but Mr. Harvey, thank you so much for being here and giving us your time. We know you're a busy man.
That's exactly
Great to be
right.
here.
That's right. So, guys, we are so lucky this morning because we have Harvey Case, who is the CEO of Carteret Health Care. And if you're like me and you've been calling it Carteret General, we want you to know that you really should up your game and start calling that Carteret Health Care.
Agree.
Which really, I love
All's
that. I think it's
forgiven.
great. I think it really speaks to the services that you guys are offering, and it is a far more appropriate moniker. So we're a fan. Carteret Healthcare and Harvey Case just actually moved to Carteret County and became the CEO of Carteret Healthcare last January, just in time
Shoo.
for COVID. So Harvey's been wearing his mask around and getting to know people. I know, Harvey, you're excited that we are seeing the light at the end of the tunnel there. And that's actually, Harvey, one of the things that we wanted to ask you guys about. You guys have got two pretty incredible programs that are related to COVID, which are this virtual COVID clinic and BAM, which I had never heard of BAM until Meg told me about it. So, Harvey, why don't we start with the virtual clinic? Tell us a little
Sure.
bit about what that is.
I will, and is glad to be here this morning. You know, traditionally hospitals, we operate from within the walls of our own facilities, and that's primarily because that's how we have historically been reimbursed. But as the healthcare industry is moving more towards value, and value is really outcomes divided by cost, and as taxpayers, none of us want to pay more for healthcare. So we're looking for more non-traditional ways to keep people out of the hospital setting. So we have put together a virtual care pilot, and it's really a way where we can monitor patients where they can really be home versus in the hospital. And the way it works is if someone was interested in being a part of this, they would be a COVID positive patient, and we would do an initial assessment by a physician or a provider. We would supply them with some basic needs, a pulse oximeter they could take home to check out their O2 levels, a blood pressure cuff, and then we would have someone that would call and check in on them to make sure that they're progressing. And again, this is a way to hopefully keep them out of the health, the hospital. So it's early, but we put this together in case the pandemic got worse, and we want to be prepared to keep people at home and out of the hospital. So
Yeah. And so Harvey, so for clarity, so your first appointment would be in person and you're given this equipment, right? And then you're set up to
correct,
be monitored by a healthcare provider.
Cool.
correct. That's
So
right.
so if someone wanted to be a part of that, let's say that we have a friend or family member who contracts COVID and then they want to be a part of this virtual clinic, what do they do?
Well, there's a phone number published, and also your physician. If you have a primary care physician, they could call and let us know as well. But there's a number to call to say I'm interested in that program.
And we can post that below in the comments because we have that number. I think Susie sent it over to us. So
I
we'll
think
be
that's
sure to
such
Very
post
a
that.
good.
smart, what a smart strategy to have
Yeah.
in place. Okay, so Harvey, then tell us about BAM because I'm just want to keep saying it.
What if is it BAM or is it BAM?
Well, it's a shorter, that's an abbreviation for a longer word, but I'm going to talk to you more generically related. So BAM is a type of monoclonal antibodies. And so I don't know if you guys, Dr. Mary Catherine Lawrence has long worked in research here in Carteret County, and she has a great relationship with Eli Lilly. And back in the summer of 2020, Eli asked us to participate in a research study. We were one of five facilities in the country at that time to participate. And for the folks that don't know what monoclonal antibodies are, so first of all, antibodies are proteins that are naturally produced by the body's immune system to fight, infection or viruses. And today we're able to make those antibodies in a laboratory. And believe it or not, these things can be quite effective and has proven to be effective against this SARS-2 virus. back in November, I believe it was, the FDA gave emergency use authorization to start using these out in the public. And because we were early in, we were in a really unique position to start treating our community back in December. And our targeted population was those that were, I think it was 58 years old or older. They didn't need inpatient care, but they were at high risk of developing some adverse reactions to the coronavirus.
Okay, so Harvey, let me interrupt you. I'm so sorry. I just want to understand. So unlike the first thing that we talked about, which is this virtual COVID clinic that you can be a part of once you've contracted COVID, this BAM, which are these antibodies that you guys can administer to patients, is to prevent the contraction of COVID.
I am sorry, I was not clear. No, these would also be COVID positive patients.
Got it.
I see. Okay,
higher risk. Higher risk for developing.
So once you're COVID positive, then you can be given these antibodies. And what is the benefit to the patient?
Well, so these antibodies, it helps the body develop an immune system to COVID-19. So the last count was we had infused 199 patients today as of yesterday, and the results have been great. So we've had a few hospitalizations, but a much fewer than you would expect based on these were high-risk patients. So it's been really a great thing to have, especially in a community of our size. You would see this at more academic medical centers and places of that nature. So we're really proud of that.
So does it essentially decrease the severity once you have COVID-19? Is that essentially what these antibodies do?
Right. Again, these antibodies act just like the body's own antibodies, and they're fighting this virus.
So it's extras.
Okay.
Just giving you some extras.
A boost. It's like an antibody booster.
That is a great way to look at it.
Thank you so much.
That's really cool. And I think that is so awesome that we are one of 5 places that is able to administer that, or that started out being able to administer that. And, Harvey, one of the things I think goes along with that is that you guys at Carteret Health Care are a part of the Mayo Clinic network, which I just think is pretty amazing. And I know we've talked about this before, but I just think that's something that people maybe might not realize, is that, we feel like we live in this small town, and that in some ways, great and maybe not so great that we're a little bit behind. But man, I mean, the Mayo Clinic is really a force, and is such a respected name in medicine and research and all of that. So tell us, kind of in layman's terms, what does that mean to a patient that you guys are a part of the Mayo Clinic network?
Guys, when I came in to be a part of this network, you have the nation's leading healthcare experts at your fingertips. And sometimes you have thoughts and ideas, and we're all doing the same things. We're trying to provide better care to patients on a more consistent basis across the country. And to be able to, pick up the phone or do a video teleconference with the Mayo folks, and they're sharing all the information they have uncovered through the years with us, it's been really an amazing thing. And so we have different things. We have something called the Ask Mayo Expert, where we can ask them very specific medical questions at point of care for patients. E-consults, where our physicians, if there's a medically complex issue, they can get on the line with another physician. And there's just so much information that we have with this group that we would not have otherwise. So it is really an amazing thing to have. And in fact, we're the only North Carolina hospital that's in the Mayo Clinic network. So we're really proud.
Yeah, Carteret Health Care.
That's unbelievable. Well, Harvey, I feel like that I have learned a lot here about the Carteret Health Care. And I just, on a personal note, Harvey, how much do you love Carteret County?
Well, I'm from New Bern, so Craven County. So this is like a second home to me anyway. So this is a dream come true to come to Carteret County.
And your kids, do your kids love it?
When you bring teenagers over, the first few months were difficult, but they're really gaining traction. So it's been very good for all of us.
Well, and Meg, I'm not even sure if you know this. Harvey is my neighbor, which I mean, it's been in the middle of COVID. I mean, I know we've waved, walking around the neighborhood, but I mean, it's been not a great time to welcome new neighbors. But I will say that your children have been so sweet and kind to my kids, and I sincerely appreciate that. And I sure do love having you guys in the neighborhood. What a gift. So,
oh my gosh, how cute.
Thank you.
I know, isn't that cool? I know.
Yeah.
So sweet. His son is always super, super sweet to Walter and helping him fish down on the dock.
Oh,
You know, yeah. So,
precious.
anyway, I know, really cute. Well, I think that, Harvey, it's time for us to ask you our favorite question.
Okay.
Yeah. So, Harvey, I don't know if you've seen an episode of this before, but we like to ask all of our guests this final question. And we are curious, what is saving your life right now?
Wow. I would say vaccinations are saving my life.
Nice.
And, to be a part of a process where there's a light out there and you're working and that light is becoming brighter and brighter is really something that gives us all hope.
Yeah.
And I think for our patients, and so we've been heavily involved in the vaccination process and the stories that have been told, the smiles, people are so excited to get a phone call to say, you're being scheduled for a vaccination clinic, this week or next week. And I think that just gives us all great hope. And so it's been a blessing to be a part of that.
What a great answer.
It really is. And I feel like a lot of times, I mean, I'm not in the medical field, bless your hearts, because I couldn't do it. But I feel like over the past year, you've had to have conversations that were pretty negative and kind of negative phone calls and stuff like that. So that's really exciting that now you're getting to make those good news phone calls and starting to see that light. So we feel that here in the community, starting to see the light at the end of the tunnel, but we know you guys are too. So thank you guys for everything you're doing.
Absolutely. We appreciate y'all so much, Harvey. Thank you. And thank you so much for joining us today.
Thank you.
Have a great weekend, Harvey.
Thanks, Harvey. Have a great Friday. Have a great weekend.
You too.
That was good. I learned.
Oh, that was wonderful. He's awesome. I didn't realize you guys were neighbors. How
I
neat.
know. It's so funny. Yeah. Yeah.
Wow.
Yeah,
Well,
I know.
Mary Cheatham, what's saving your life?
I tell you what I have decided that what's saving my life is I have treated this week, Monday was March 1st, and I've treated this week like it was the first week of the year. So I just felt like I needed a do-over. Some of my intentions that I had set really hadn't gelled and materialized. And so I felt like I needed to stop and say, wait a minute, I would like to reset that intention, please. And so I loved that the 1st of March was on a Monday, so I could kind of have a do-over. And I think that was obviously pretty arbitrary. But so what I would say to anybody is, if you need a do-over, just take one.
I love that. Well, I just said your line. Sorry. I stole it from you.
You stole my line. That's exactly
your
right.
line. I like that. And you said that on Monday morning. You were like, all right,
today's
January 1st.
Yeah. And it made me feel, instead of thinking about the things that I hadn't done that I intended to the first 2 months, it made me think, oh, it's a fresh start.
Yeah. But also, like, I'm thinking back on the first 2 months of the year, specifically for our team. I mean, it was a crazy 2 months. We had a lot of moving parts and all of that. So, I mean, give yourself some grace too, knowing that those first 2 months were not normal. And I mean, things are crazy between a pandemic and personal team things and stuff like that. So I really like how you can you just wake up one day and you're like, okay, I'm just going to flip it back to January 1st.
We get to choose, which I
it's
think
all the mental. Yeah. It's the mental power.
And as a side note, I will say the other thing that's saving my life is just you guys, that video and that sweet caption from the post that y'all did for my birthday last week was just so dear. It was just so dear.
Well, we wanted to make you laugh and cry. So I think,
oh my God, you did it. You absolutely did it.
Fantastic.
Yes.
We love that.
That was hilarious. I know. I've been trying to stop. I texted my mother-in-law.
Do not stop.
On Friday, and she responded and said, "Did you love that?"
Oh,
my mother-in-law's in on it. My father-in-law logs into my Facebook. We share a Facebook account.
I do know this. Yeah, that really cracks me up.
He was on my Facebook watching the video.
Yeah. We loved that.
We loved that. Yeah. So how about you, Meg? What is saving your life?
Well, the thing that has saved my life, this is for the past 2 weeks, but on Tuesday, so the past 2 Tuesdays, my little dog child has gone to school with Colt, who is Beth's boyfriend.
Yes.
Beth works with Belinda and Brittany. Obviously, you know that. I'm telling everyone else here.
Yes, on our team. Beth worked with us. Yes.
Yes. And Colt owns Carteret Canines, and I wouldn't call it a dog training place. I would call it more dog psychology, if that makes sense. I know you've met with him before, but just the things that, like, his philosophy on training your dog is so mind-blowing, and it works. And we send Bo to Colt's house every Tuesday from 8 to 5, and he just comes back a new dog. So
I need to send Buddha there.
that is saving my life. I took Bogey this weekend to the new coffee shop in
Right.
or last weekend in Morehead, and he just sat there. Like, before, he would have been like swimming all over the floor, going crazy, and he was just, what's up? So I credit Colt for saving my life.
Great job, Colt. Great job, Colt. Let's drop Colt's information in the comments below too.
Absolutely. I also, like, kind of don't want to give away that secret, but we'll do it for Colt.
Well, you the cat's out of the bag, Meg. So
Yeah.
now you gotta share the whole thing.
True. Meow.
Yeah. Well, thank you. Happy Friday.
Happy
week
Friday.
Flown by.
It really has. I hope you have a great weekend, and I'll see you on Monday.
Sounds great. Thanks, Meg.
Bye.
Bye.